Let's look at medical tourism. Now, the practice of seeking medical care from one border, from one country, one continent to the other has seen substantial growth. Now, this involves an interplay of different factors ranging from technological advancement to specialized care and a host of other things. Now, you should note that Nigeria spends an estimation of $1.2 to $1.6 billion on medical tourism every year. Now, the different reasons why Nigerians embark on medical tourism, one of them, like I mentioned earlier, is technological advancement, specialized care, convenience, and even the wait time that people spend at hospitals is part of the reasons why Nigerians embark on medical tourism. Now, the following countries are popular destinations for medical tourism from Nigeria. We have India, we have Thailand, we have Turkey, Malaysia, and Singapore. The most common medical procedures sought by medical tourists from Nigeria are cosmetic surgery. We have fertility treatment, heart surgery, kidney transplant, and cancer treatment. Joining us via Zoom to talk about this is Nancy Adbelhdi, who is Director, International Relations, FACO Pharmaceuticals, Egypt, CEO, and Ibis. So we'll look at all of that when we bring in Nancy. But first, looking at some of the reasons why Nigerians embark on medical tourism, technological advancement, specialized care. How does that make you feel as a Nigerian?
It's a sad commentary. It is a sad commentary. Yeah, we've spoken so glowingly about all the types of, tourism. We spoke glowingly about film tourism. We spoke about sustainable tourism, and we even looked at the third part of it, cultural tourism. These were on the bright side of the discussion, but when you look at medical tourism, for us as Nigerians, I said it's a sad commentary because it underscores one fact, that we have not made enough investment of resources in our medical research, and we are not able to take care of our own people. The local technology in terms of healthcare is not being developed. Like you just read out, between 1.2 and 1.6 billion dollars is spent every year by Nigerians on medical tourism. I think the word medical tourism is nothing but a euphemism. It is not tourism in any way, because tourism is meant to be for you to go somewhere and enjoy what you don't have.
It's supposed to be fun.
But this is not fun. You are going there for life saving. People who have issues with their kidney go to India for kidney transplant, and so on and so forth. For us as a country, and for Africa as a continent, we have so much more to do. We are always on this giving side of the equation. We are the ones going there to spend the little that we have here, as against promoting others coming to spend the much that they have here. What happens to us here developing our own local technology health-wise? And we do not lack the capacity mental-wise, because even when you go to the USA or some other parts of the Western world, you will see that Nigerian doctors are doing fine there.
Yeah, which brings us to specialized care. So I think it is a thing of where the specialized doctors or the specialized medical medical experts are located, not a thing about the country you're from. Because we've talked about the issue of brain drain being a real problem, particularly in the health sector. Like you just mentioned, we have a lot of Nigerian doctors who have relocated abroad. So when some Nigerians even go out of the shores of this country seeking medical attention, they still come before the Nigerian doctors. So it's not like we do not have the specialized experts here to take care of medical needs of Nigerians. It's just that we've not developed capacity to retain them, and so they've moved. And so Nigerians are now moving to seek them where they are. All right, now let's bring in our guest, Nancy Adbelhdi, who is Director, International Relations, FACO Pharmaceuticals, Egypt, the CEO, and also IBIS. So welcome, Nancy. Good morning.
Good morning. How are you?
I am fine. Thank you for joining us. You're calling from the U.S. It's a lot of sacrifice doing this, and we appreciate it.
Appreciate it. Thank you so much for having me.
You're welcome. So moving forward now, looking at medical tourism, what are your thoughts on it. Now, tourism, like we've stated here, is supposed to be fun, but we've seen that over the years, people move from one country to the other seeking medical care. Should it be something
Yes.
that we want to develop, or countries should develop?
Yes, you're right. And when we speak about medical tourism, it has kind of two sides to it because we talk about, from one side, Africans traveling outside of the continent to seek medical care, usually in the Western countries, or the other side, which is African countries actually developing either national or regionally their healthcare facilities to actually attract more medical tourists. So it's kind of both sides. It's again, people traveling outside of the continent to get medical care, and also different African countries trying to develop their own medical tourism. And it's an important aspect of each of our African countries and the region's economy, but it also has its pros and cons as well.
Okay, let's look at the primary reasons that Africans, advance forward before they embark on medical tourism. From our own initial conversation, we spoke about the fact that maybe we don't have the healthcare facilities around here, or maybe it's the lack of political will on the part of some African, governments to do this. What other reasons, from your point of expertise, do Africans advance for embarking on medical tourism?
Yes, sure. So from the one side of Africans traveling abroad to seek medical treatment, again, it comes from a lack of trust in their own healthcare facilities. So they're either leaving the country because they either are looking for more affordable healthcare treatments or looking for advanced treatments because their perception is that the quality of care they will get abroad is better. In the sense of within the countries itself, like you said, the government, the political will to actually invest in the local healthcare facilities or even the private facilities that can attract the medical tourists. So this is a major step in terms of a country developing its medical tourism.
Now, what are the long-term consequences of relying on medical tourism for provision of medical care?
Sure. Well, I mean, if we're looking at, for example, several of our African countries, including our country, Egypt, several of our, let's say, political leaders have traveled abroad, at the expense of the government, to seek medical care. So this is a drain, of course, on our individual economies. That's one thing. That's also, if we're talking about private individuals, that's money not being spent in the country, but being spent abroad. So it does have long-term consequences. And again, for people to perceive that they cannot access quality care in their own countries. This is a big problem because, again, as you had mentioned, it causes also a brain drain because many of the professional healthcare experts, doctors, nurses, they're actually leaving their countries to go to some of these countries that are known for medical tourism because they have better salaries, benefits, opportunities also to work with advanced, medical technology. And so we're losing a lot of great doctors. And I know you mentioned earlier, like the fact, of Africans traveling, let's say, to the West to seek medical treatment. And much to their surprise, the doctor who's actually caring for them is an African doctor, which we see often. One of the top experts in liver transplants in the United States actually is from Egypt, and he's in Pennsylvania. So this is quite common. Very sad, though, that we as Africans are not directly benefiting from those professionals in our countries.
Okay, let's look at the place of, insurance, health insurance, comprehensive and affordable health insurance in discouraging, medical tourism. especially for Africans? Because there is so little that individuals can do on their own, but insurance is a kind of leverage they can take advantage of to make things happen beyond their own financial limits. What should be the exact role of medical insurance in discouraging medical tourism from the African point of view?
Okay, so if we're looking at the idea of Africans, let's say, traveling abroad because they are seeking more affordable healthcare, that's an issue because there's a need for like national healthcare coverage. So citizens should have access to affordable, safe, effective, healthcare within their own countries. If you're looking also like I want to give you an example with Egypt, for example, our company, we had a campaign, it was called Touring Cure, which is, a very successful medical tourism campaign. And the idea was to provide treatment for people with hepatitis C. So it was encouraging people from all over the world to come to Egypt to get the treatment. It's affordable. Well, the government actually, as part of that, they offered this screening and treatment to the citizens, to all the Egyptian, because Egypt is one of the countries that was most affected, by hepatitis C. And so the treatment was offered for free. So it was sort of like a national coverage for screening and for also treatment. So this is something that's quite important for governments to be able to provide access to quality healthcare for their citizens. So healthcare, national healthcare access and insurance is essential in order for people to not think of leaving their country because they will have access to affordable and effective health treatment.
Okay, from what we've all alluded to, as the fact that we have the specialists from Africa that can actually cater to whatever specialized medical need that Africans would have. So what then is needed to develop the health sector in Africa so that Africa can begin to gain from medical tourism?
Yes. So one of the things, and the main thing, is investment. There must be, and this starts from the government, there needs to be more investment into the healthcare systems to develop those systems. There need to be more investment in research. And that comes also from partnerships with centers of excellence from around the world for other, international health facilities or institutions. And we see several of those partnerships. Like, for example, again, in Egypt, we have 357 Hospital, which is a pediatric cancer hospital, and it's a center of excellence. And there's a strong partnership with Harvard Medical School and also St. Jude in the United States. So if we see this happening, in Egypt, and we have this all across the board in Africa, many centers of excellence, many medical facilities that have partnerships with these international institutions or organizations, because this can also help us build capacity. So providing training for our healthcare professionals, because again, one of the main things that Africans decide to travel to the West or travel abroad for healthcare is because they perceive that they will get better, quality of care. They will have more professional healthcare, providers. Whereas if we invest in training our own healthcare professionals, this will also help a lot to, avoid from people thinking that they need to travel abroad to get quality care.
Okay, you spoke so glowingly about Egypt and what Egypt is achieving in the area of medical practice. And if you ask an average Nigerian, he will probably speak about what Nigeria can do. A South African will do the same thing. Now, this speaks to something, an idea in my head. What about the possibilities of collaboration by African governments to come together and pool resources, not just in terms of funding alone, in terms of expertise, cross-border exchanges that can lead to a big, giant medical institution that Africans can actually, take advantage of as against shipping money overseas because of medical tourism. What happens to that kind of collaboration? Is it possible, or is it in the works in the first place?
Absolutely. It's essential. One of the things is, like you said, collaboration. Sharing best practices, sharing and pooling resources. We see this, for example, with telemedicine. There are several successful, I can think of offhand, Nigerian telemedicine, companies that actually have crossed borders. Many of their doctors are actually Egyptian, because with telemedicine, now, I can be sitting in the United States and I can, be on a call with a doctor in Morocco or in Nigeria or in Egypt. And so this is really, it's cross borders. But what you're saying is really key, and it goes back to South-South cooperation. So we as a region, Africa and developing countries, if we pool our resources, if we share best practices, if we establish, centers of excellence that are in strategic areas. You have a center in Ethiopia, and you have a center in Egypt or in Nigeria and Kenya. This will then again help us to build trust among Africans, that they don't need to travel outside of the continent to get quality healthcare. They can receive that quality healthcare from within. And again, because we have limited resources, it's so easy to say we need to invest in the healthcare facilities and to improve and upgrade our healthcare system. But where do those resources come from? So what you've said is quite strategic. If we're able to pool those resources, if we're able to benefit from the different expertise. So Nigeria is known for, specialized surgeries, while Egypt is known for dental or cosmetic surgeries, while Morocco. So if we actually, as a region, also cooperate in the sense that each country can actually develop their own expertise or, be specialized in a specific medical field, that's key.
Okay, let's move away from orthodox treatments to alternative medicine, which Africa seems to have a lot of resources that can be used. So is there a way to build capacity in this area so that we can maybe have some form of comparative advantage in that sector, as we seem to be doing a bit of catch-up when it comes to drawing people or attracting a lot of people to Africa for medical tourism using orthodox treatments?
Absolutely. And again, I'm sorry, I keep going back to the example of Egypt, but for example, we have Aswan is quite known for alternative medicine treatments, wellness and different treatments that actually, are non-invasive. And Egypt is, or Aswan is just one example, but I've seen this in many countries across Africa. And I think, like you said, we can champion, ourselves as a continent and excel in that. Again, it just takes cooperation. It just takes investment in that, developing that section of the healthcare system. I think we can definitely have an advantage for sure.
On the very last note for me, I know we've spoken glowingly about the need for Africans to come together and build their own health infrastructure. But that is not a one-day assignment. It takes time. And while we work on that, people will still need to get better. They still need to access health where they can find it, meaning medical tourism is not going anywhere soon. Okay, but then what are the ethical considerations that we should put into use when we are embarking on medical tourism? Now that we really can't, self-cure ourselves at this point in time, what are the ethical practices we should use when we're embarking on medical tourism?
Yes. So you said something very important again, cooperating on a regional level in terms of developing medical tourism across the border, and this is something that can definitely benefit as African countries, our individual economies. But the ethical considerations that we must keep in mind is we cannot compromise investment in, local healthcare facilities just to promote or develop our medical tourism. And we see this a lot. So the money goes into the urban communities versus the rural communities. And so the citizens themselves don't have access to safe, affordable, effective healthcare. So there has to be a balance, in a sense, that when we're promoting this medical tourism, it cannot compromise or take away from investment and development of, local healthcare facilities and the services that are provided to each individual citizens. So this, I think, is one of the top ethical considerations. The other thing is the patient themselves traveling to the different countries. They need to have access to information. Their consent needs to be given. They have to give their consent and be aware and informed about what medical treatment they're going to be receiving. There shouldn't be any cultural language barriers. And this is why in these facilities, we train the professionals to speak, the major languages like English and French, for example. So there isn't this miscommunication between the healthcare professionals and the patients seeking treatment. So I think these are the majority of the ethical, points. And again, with the brain drain, so medical professionals might leave the local hospitals or clinics, seeking jobs in those facilities that offer medical tourism because the salaries will be better, maybe the benefits or the opportunities there. So again, this might take resources from the local healthcare system. So there again has to be a sort of balance.
Okay, given the economic disadvantage that medical tourism is to Africa at this point, and the poor perception that it gives the health sector in Africa, what policies should African leaders be looking at? What areas of investment should African leaders be looking at as regards building self-reliant healthcare systems?
Yes, so those policies, again, as we mentioned, it's important to have partnerships and collaboration, whether it's between, the different countries within Africa or between our healthcare facilities and international partners, centers of excellence abroad. So the government, in terms of like the paperwork, taxation, those types of like red tape, things should be streamlined, to promote and to encourage, also investment into the healthcare system. In addition to that, for tourism purposes, because again, this is medical tourism, the government plays a huge role in terms of also streamlining the visa process, making it easy for tourists to come to the countries, to find proper and safe accommodation, transportation. The infrastructure should be developed. So investment not just in the healthcare centers, but also in infrastructure. This is all from the government side. In addition, again, like I said, making the process easier, whether it's for the investors who are, investing in medical centers that will be working in the medical tourism side, or in the side of partnerships with other countries and also international institutions, or with the patients themselves, making it easier for them to travel. Like I said, the visa process. And this happens also in partnership with the tourism authorities or Ministry of Tourism. So having that partnership helps streamline the process and makes it a better experience for both the provider and also the patient that's seeking treatment.
All right, we must say a very big thank you to you, Nancy Adbelhdi, for joining the conversation. We have been educated, and I do hope that African leaders will take some of these things to heart and make Africa a destination of choice, even if there will be medical tourism. Thank you very much once again for joining us.
Thank you so much for having me. And if you allow me just to say one last quick thing.
Okay.
Also with the African Tourism Board. So this is something when we talk about collaboration and we talk about partnerships, these regional organizations can help, just like the African Union, you know, to promote collaboration between us. We as a continent are powerful in all aspects of our tourism. And if we work together and work on a regional level, we can be very successful. And I'm very optimistic. And thank you so much for having me today.
Thank you too.